Hello again, this is Dr. Mark Cooper, and I'm a psychologist working in the field of chronic pain management. And I've incorporated natural health strategies and traditional psychological strategies in the field to help patients with chronic pain. And today, I want to talk about food sensitivities because food sensitivities are a contributing factor to migraine headaches and to a lot of autoimmune problems like fibromyalgia and chronic fatigue and other autoimmune diseases. And so trying to figure out what food sensitivities you might have and what might be contributing to your arthritis or your joint pain is probably a good idea. And it's something you can do independently, and you don't need a physician or to do that with. So we've found a way to assess this more in the natural health field. But before I go into specifically how to do that, I want to talk about the underlying rational reason for doing it in the first place. In the field of psychology, there was a theory that was developed by Dr. Seligman that was called learned helplessness. And back in the late 1970s, he developed this theory of learned helplessness, and basically it was a theory concerning depression. But it's specifically appropriate for the field of chronic pain because a lot of people who have chronic pain get depressed because they don't have strategies to control their chronic pain. And if you can help an individual figure out what's caused the underlying cause of their chronic pain and help them to do something about it, they don't typically get as depressed, because they have a coping strategy for it. Now, one of these coping strategies is, again, trying to figure out your food sensitivities that are contributing to your chronic pain, especially fibromyalgia, chronic fatigue, and arthritis. But back in the 70s, what they did is a bunch of studies with rats. And what they did, they put these rats in a cage. And it was an electric cage where they had electric grids underneath it. And they would put the rats in there and they would shock the rats and they would bounce around. But they added a little lever here on the side that if the rat accidentally hit that lever, the electricity would be cut off. So after a while, the rat's bouncing around, he accidentally hit that lever, and lo and behold, the electricity went off, and he wasn't hurting anymore. So the psychologists added another step to that. They turned a light on right before they put the electricity, turned it on. And of course, the rat would be bouncing around and see that light and then hit the lever. But after a while, he learned that as soon as he saw that light, he could run over there and hit that lever, and he never got shocked. So he learned the coping strategies for his chronic pain that we were giving to him. Pretty soon, he was able to do that very effectively, and he went on with his life, and no problems. Light comes on, he turns the lever off, never gets shocked. And then, like a lot of psychologists, we get a little devious, and we decided to change the rules of the game, without the rat knowing it, of course. So we made the light come on, the electricity come on, and the lever not work. So at first, he would go over there and get very aggressive and bounce up and down on the lever, just bounce, boom, 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 but nothing would happen. But after a while, he just gave up and laid in the corner and let the electricity shock him. He would just jerk. And that's what we call really the learned helplessness, because he didn't know anything else he could do to stop that electricity and the pain that he was having. That's pretty harsh. But what we learned in that, and then we reversed it later so we didn't have to go through that again. But what we learned in that is that's the what happens in chronic pain patients is that they hurt so bad that there's nothing they can do for it, and they get depressed about it until they find some sort of treatment. And sometimes it's a narcotic, and sometimes it's something else. But whatever it is, it helps with the depression. But then you get other problems with all those medications. So today I want to talk about a strategy that's really diet that kind of helps people with chronic pain management, and especially food sensitivities. And it's a strategy that a person can learn themselves and figure it out on their own. And then when their pain goes away, they've learned. But what I found in chronic pain panics is that the problem with figuring out food sensitivities is sometimes it's not immediate. You might eat something and get bloating, or you might eat something and get diarrhea. But in terms of chronic pain, it might happen 30 minutes, it might happen 2 weeks down the road. So it's really hard to figure this out. So in natural health, they develop some strategies to figure this out, and it's called energy testing. Now, energy testing, there's 3 forms of this. There's one that where you use muscle testing, there's one where you can use your own balance, and there's one that you can use with actually dowsing. And we're going to talk about all 3 of those techniques. So the first technique is what we call kinesthetic testing. Now, there was an author called Dr. David Hawkins, who was a PhD and an MD, and he wrote this book called Power versus Force. And you can pick this up and read it in more detail if you like. But basically, it goes like this, that anything that you put in your energy field will either make you weak or strong. So if you pick an orange up and put it in the energy field, it's going to either weaken you or strengthen you or be sort of neutral. Or you can pick up an apple, or you can do a candy bar. And you can figure out from that which ones that might benefit you. Basically, we found out in psychology or other fields that you only use about 5% of your brain. And your unconscious mind really is pretty powerful, and it will help. And this technique helps you bring your kind of an unconscious knowledge to your conscious awareness. Okay, we're now going to use a live demonstration and instruct people in how to use this technique to figure out your food sensitivities that might be the contributing factor for your headaches or your pain complaints or your fibromyalgia or your chronic fatigue or your GI problems. So I've got a friend of mine here that's volunteered to help me with this. So I'm going to give her what we call a post-hypnotic suggestion. That if I put something within your energy field, and if it's good for you, you're going to feel yourself pulled forward. If it's bad for you, you're going to feel yourself rocking back. And if it's sort of neutral, you may feel yourself just swaying around. So we're going to test this apple first. So you hold the apple there, take a deep breath, and relax and drop your shoulders, and close your eyes and relax, and see which way that pulls you. What'd you find?
Forward.
It pulled you forward. All right, good. Now we're going to try an orange. See what this orange does. Okay, pick your shoulders up. Take a deep breath. Relax your jaw. See if it pulls you forward too. So in her case, apples and oranges are pretty good. Now let's try the old candy bar. Hold that. Take a deep breath. Relax. See what happens. Oops. You can feel yourself pulling back. So this would be one of the things you should want to start avoiding to eat. All right. Now, I've got a sheet here where I've pulled it together for patients so they can test all their different food groups instead of strong, weak, or neutral, and put it all down on a sheet of paper and every type of food group and even some blanks for some other things. And that way they can fill this out and then try to follow it for 3 to 4 weeks and then see if their pain conditions improve. Now we're going to talk about the second strategy. This is called an energy technique as well. And this is where we put the food within the energy field and test their strength. And you hold the fingers up, and you can use 1 or 2 fingers. She's going to use this one, and we're going to see if it's weak or strong. All right? And in that case, she's pretty strong with it. All right? So that would work pretty good for her. Let's test the candy bar again, and let's see. See, it breaks easy. And I'm not pulling any different in strengths one way or the other. Anybody can pull their fingers apart and break it apart. But the key is whether she feels difference in her strength or not. And some of the chiropractors use the ones where you hold your hand out and push it down. I just found this one a little bit easier for me to use. But anyway, all right. Thank you very much for your participation. The third technique that I want to talk about is using dowsing as a technique. Now, in dowsing, there's a theory again that you're being able to take unconscious knowledge and bring it to a conscious awareness. And so how you use this in food sensitivity is I've got a pendulum dowser here, and that if this food is good for me, then it's going to swing forward. If it's bad for me, it's going to swing side to side. If it's sort of neutral, it's going to kind of go around in circles. Now, this is the way I've trained my body and my mind to use dowsing for food sensitivities. Now, other people use it a little bit differently. There is a guy named Raymond Grace, and he has a program, a presentation that he does and trains people online or in person to use dowsing for a variety of issues, and you can look him up if you want to and do it further. But the way I do it is I hold the food inside the energy field, and if it goes forward like this, then that food is probably, my unconscious mind is telling me that that food is beneficial for me, and it would be something that I would want to include in my diet. And I'll test the candy bar for me, and let me relax for a second. And basically, you can see the dowsing going side to side. And in that case, sorry to say, but this particular type of chocolate candy bar is not that good for me or beneficial for my food, for the things that I want to eat. And so that's how you test it. But I will say this about dowsing. You really have to train yourself in this technique, and that may take some energy and some time on your part. Now, with all that said and done, in all three of these energy techniques that I just demonstrated, if you want a little bit more objective view of how to pick food sensitivities, there is a program online called ALCAT, A-L-C-A-T, and that's some blood work. And they can send a phlebotomist out to your house, take some blood out of your arm, send it off, and it will come back in degrees of food sensitivities. And then you have to do the same behavioral health strategies and try to avoid those foods that you find are sensitive to you, and then see if your health issues like your GI problems, or your fibromyalgia or chronic fatigue actually improves over the course of time. So that's an objective way you can do that. And the only problem is insurance doesn't pay for it, and it's kind of costly. But it's a very objective way. Now, I've done this in the past where I have done my dowsing techniques and my muscle testing techniques, and then we've had someone go off and do the blood work, and we were very, very consistent. And I think I missed one item out of 300 with this particular individual. And so we were able to be very consistent with this muscle testing technique with the blood work. And then in the end, the patient made significant physical improvements in her health. So that was a good situation for her. I hope that you find this information helpful to you. Maybe you can use it. And again, I am going to have this form here available for you if you want it. You can download that off the internet. Thank you very much.